Hi there, my name is Dr. Maureen Waithaka. I am an anatomic pathologist. And welcome to my channel. This is PathEd. PathEd is a medical education podcast. On PathEd, we'll be discussing basic pathology based on a Kenyan undergraduate medical curriculum. So if you went to one of Kenya's medical schools, Nairobi University, shout out, or Maseno, Kenyatta University, or Egerton, and you're studying a medical degree, you would learn pathology in maybe second or third year, and that curriculum is what we'll be exploring on this channel. But if you're a non-medical person, the language here will be distilled in such a way that you can get into it. If you're conscious about health, you want to learn more about health, about how the body works, because that's basically pathology. We'll see more about what it is, but we learn a lot about how the body works in pathology. So if you want to learn more about that, the language will be very simple. It'll be, just simple language that you can get into and learn about. Today's episode will be tackling the most basic question, which is, what is pathology, right? And to begin, I will use 4 vignettes to illustrate various points. Vignettes are little descriptions of patient history. So in a vignette, you get to hear an age, gender of the patient, then you also get to hear symptoms. And vignettes is how medical exams in North America are done. The theoretical exams, the long short answer question type of exams, even the multiple choice question exams, you get a small vignette that tells you a bit about the patient, their age, their gender, and then the symptoms, and some pertinent history. And that's what enables you to make the diagnosis, which is what the question will ask. And then there'll be various other questions that could be asked in that using that one vignette. So vignette is a good way to give you a snapshot of a patient, right? So when you hear a vignette, the thing you should be thinking is, what's the diagnosis? Okay? So these 4 vignettes, I'm using them to illustrate how in the clinical setting, pathology comes in, because it's very, very useful. It's done a lot, but I think most people aren't aware that the thing they went to have done in the lab is pathology. So let's look at these 4 vignettes. Okay, so the first vignette will be of a 10-year-old boy. It's a 10-year-old boy with recent onset fever and vomiting after a trip to their country home, which is in Nyanza. Okay? So the second vignette is a 40-year-old man with a long-standing forehead mass. It's 2 centimeters in greatest dimension, and it's soft in consistency. And then the third vignette is a newly diagnosed HIV patient. This patient has cervical lymphadenopathy. That is swollen lymph nodes in the neck region. And this patient also has what are called constitutional symptoms, which are fever, weight loss, night sweats, and this patient has no cough, which is noted. All right. Then the fourth vignette is an interesting one. This one is a 54-year-old man who died suddenly after reporting vague chest pain. Okay? So those 4 vignettes, once at the end of this episode, we'll look into detail as how pathology comes into the management of that patient. It's mostly the diagnosis, but that's part of management of the patient. So let's look at some definitions. In medicine, you can't avoid definitions. And in undergrad, some of the exam questions could be define pathology, if you're lucky. So what is pathology? Pathology comes from a 17th century Latin term, and it's made up of the suffix, which is ology, which means the study of, and the prefix, which is patho. Patho means disease. So basically, pathology is the study of disease. And to study disease, or what happens in the body when disease is going on, you have to learn what happens when the body is normal. That's why I said many of these episodes will feature what happens, what's normal, so we know what abnormal is. Yeah? Okay. Now, for a long time, pathology had been relegated as an optional service in patient management. But with modern medicine, there's what is called evidence-based medicine, meaning that the doctor has to have evidence for the thing they're treating. So if your doctor, for example, diagnoses you with malaria, they have to have a diagnostic test that is illustrating the malaria, so they can justify giving you anti-malarials. Okay? And the same thing, for example, if you have pneumonia, a broken bone, there has to be a diagnostic test. Often it's pathology or radiology. Radiology is imaging studies, basically x-rays, MRI, CT scans. So any one of those, as long as it says diagnosis this, then the doctor is justified in treating you. All right? Okay, so evidence-based medicine is good because, number one, it prevents misdiagnosis, because many things clinically look the same. Pneumonia, TB, someone with reflux disease, they can all have a cough. So if you base a cough diagnosis on, pneumonia on cough, a pneumonia diagnosis based on a cough is poor medical practice if you don't follow up with some kind of diagnostic test. So misdiagnosis would happen a lot if we just use clinical symptoms. Yeah? Okay. And then it also prevents the patient from undergoing unnecessary treatment. I've had so many cases where my friends and family tell me I went to see a doctor. I didn't have any tests done, but they gave me typhoid medication or malaria medication, or sometimes something really serious like brucella medication, or you've had a diagnosis of brucellosis. That's really serious. If you don't have a test to back it up, it's very, very unethical to then administer medication. So evidence-based medicine is what best practice is moving towards, and it's what is going on. Diagnostic tests are becoming more and more useful, more and more pertinent to patient management. All right. Now, pathology in the medical setting often involves examination of one of the body fluids, which could be blood, urine, or stool, many others. It could also be the examination of surgically removed tissue or organs. So let's say a kidney is removed or a biopsy is done. A biopsy is where a piece of a tissue is removed to be examined. So that's pathology. And also, in some cases, the whole body is examined. And this is often after death, post-mortem, which is autopsies, right? And all these are to come up with some kind of diagnosis. In the pre-mortem setting, if it's in a clinical setting before the patient has died, it's to enable the doctor to be able to find what's going on and give you the appropriate treatment. And then post-mortems have various utilities, as we'll see later on in this video. Okay? One final thing is pathology in the clinical setting is often divided into two branches. So we have one branch which is anatomic pathology, and one branch is clinical pathology. And anatomic pathologists, which is what I am, we deal with biopsies and autopsies generally, right? While the clinical pathologists deal with the body fluid analysis, the haematology, which is the pathology of blood and blood disease. There's also chemical pathology, which deals with studying the body fluids for things like sodium, potassium, electrolytes. That's chemical pathology. And then also immunology, which is the diseases of the immune system, also comes under clinical pathology. So this pertains to how medicine is studied. So when you go to a medical school, you first do your basic undergraduate degree, then specialize, and you can either do clinical or anatomic or a combination degree, which is called general pathology. So yeah, we'll talk more. There'll be an episode specifically for medical training to show how it's done and how it's different in Kenya and in Canada. So the final part of this podcast episode is us discussing our 4 vignettes and seeing where the pathology comes in the management of those 4 patients. Okay, there's a really cute dog. It has like a whole outfit. It has pants and a jacket and like boots for every leg. It's so, I wish we could show you, but the setup, no, that's also the dog is with the owners. We don't want to record them, but it's so cute. Oh my god. Anyway, so our 4 vignettes. Let's begin with the first vignette, which is a 10-year-old boy with recent onset fever and vomiting after a trip to their country home in Nyanza. Now, when you're looking at a vignette, it's important to pick up very quickly on the pertinent issues. Remember, a vignette will come mostly when you are in an exam setting. So in this exam setting, it's good to be able to quickly pick up on what you need to and make the diagnosis. A vignette often will require you to make a diagnosis, and it's often quite obvious. I've made very simple vignettes like third year medical school type questions. So this vignette is supposed to give you an answer, and the answer is malaria. So the doctor who's seeing this patient will correctly, appropriately suspect malaria. And like we said, we're now dealing with evidence-based medicine, meaning that if the doctor wants to give anti-malarials, they have to be sure that this patient actually has malaria. So what the doctor would do is send this patient for a malaria test, right? And guess who will look at the test? That's right, a pathologist. A clinical pathologist will look at a slide where the blood of that patient has been smeared, right? That is a glass slide which will be put under a microscope, and then you'll see malaria parasites. They are called plasmodia. If they are present, and then you make the diagnosis, the pathologist will make a report for the doctor, and then the doctor will be able to then treat the patient. So another concept coming out here is that the pathologist is the doctor's doctor. That pathologist is communicating directly to the doctor. The doctor basically asked a question. The question was, I think this boy has malaria. Am I right? Okay, then sends the patient to the lab with a request form. That's basically what the request form that you take to the lab is. Then in the lab, the pathologist will see the request form and understand the question, and then pick what test to do, the appropriate test. And once that test has been picked, has been done, is positive or negative, a report is made by the pathologist to be given to the doctor. In that way, the pathologist and the doctor are communicating directly. Often the content of reports of a pathologist are very complex, and rightly so, because they have to give important details of the patient's illness and diagnosis to help the to help the doctor who's seeing the patient treat the patient. So the pathologist is the doctor's doctor. We are talking to the doctor, right? So another thing is, I can't overemphasize the importance of being able to read vignettes quickly. So let me just go through that vignette again to see what the important points that should be picked up on are. And those are the age, 10 years old. So that means that the patient is in the pediatric age group. The pediatric age group is prone to illnesses that are unique to them because of their immune system and various other things. So the pediatric age group is prone to getting malaria more than the adults who went to the child to Nyanza, right? And then the other thing is recent onset, fever and vomiting. That means that the illness is acute, right? It's come on suddenly. It's unlikely to be a chronic illness, all right? The third clue is Nyanza. Not to be biased or anything, but Nyanza just happens to fall within the malaria endemic zone of East Africa, which includes the coast and other various parts of Western Kenya. So the travel, recent history of travel is very, very important in this case. Very, very important, because that's what gives the actual, this could be this thing. It ties in the diagnosis. So when you're looking at a vignette, it's really, really important to be able to pick up quickly on the pertinent issues and be able to make the diagnosis. All right, so that's how, in this case, pathology comes in. So the second vignette is of a man who has a forehead mass. This mass is long-standing. It is 2 centimeters in greatest dimension, and it is soft. So the pertinent things to note in this vignette are the fact that he has a forehead mass that is long-standing. Long-standing often points to something benign. It's been there for a long time. We aren't getting told that it's having any adverse effects. So it's likely to be just fine, right? So long-standing often means benign. So that's good to note. Oh yeah, the man is an adult. He's 45 years of age. That's important because it's just basically saying he's an adult. Yeah, so adults can catch many different things. It's not really as important as pediatric, but it's just important to note that it says he's an adult. The other thing is the mass is soft in consistency. That actually points towards a particular diagnosis. There are masses which are soft. And then the last thing was that it's 2 centimeters in biggest dimension, meaning it's a pretty small mass, also pointing towards a benign thing. It's not a rule of thumb, but benign things tend to be small and malignant things tend to be large. But not always. A thing our teachers always used to say is that our diseases don't read the books, so they don't know what they're supposed to be like. Just to help you remember that there are exceptions to the rules, right? Okay, so soft mass, 2 centimeters on the forehead, that's a lipoma, basically. A lipoma is a benign tissue of mature fat. And what will happen likely is that this patient will go to see a surgeon. And then the surgeon will recommend a biopsy, excision biopsy. They'll just take out the whole mass. That's a kind of biopsy called excision, meaning the mass was taken out. There's one called incision, where they go into the mass and take a small piece of tissue. That's an incision biopsy. So this excision biopsy will be sent to a special kind of lab, which is the kind of lab where I work. That lab is called a histology lab, right? That histology lab is really, really special. The lab converts the tissue, fresh tissue, into a glass slide, right? And I'll show you the glass slides as soon as I'm able to stop. Okay, so like I said, that patient who had a forehead mass, the tissue, which will basically look like a blob of fat, will be converted into a glass slide. And let's take a close up look as to how one looks like. And this is how it looks. Let me place this here so that you can see. Wish I had a white background. Improvisation. Let's use a piece of tissue so I can show you. For a tissue in a glass. Okay. So that's how the tissue will look like once it's been processed into a glass slide. You see it? It's a piece that is a very thin slice. Like if I show it to you from the side, you can't see the thickness. It's actually measured in microns. It's a very thin slice of tissue and it's been stained. You see this pink color? It's so that we can be able to see it. Otherwise, if it was clear under the microscope, it would be very hard to see. So this slide is then placed on the microscope, and when you look, you'll see various images. Like I'll show you how the images look. And this is the thing again that you can take a picture of. There are machines called slide scanners that take very high resolution images of these glass slides. So you get a very high resolution image of this micrograph, right? And you can look at that high-res image anywhere as long as you have a computer or a tablet or a phone and internet, right? So the application of digital tech to pathology is being done, and it's changing the way that we work, from receiving a batch of glass slides being put on a microscope, so I'd have to have a microscope to do this work, to now being able to download an app where I can see these images, very high resolution, basically at the click of a button with my phone, with my laptop, meaning I can even work like right here. I can be here with my laptop making my diagnosis. It's good also because pathologists are very rare. We are very rare, meaning that we are stretched thin. We have to do lots of work, lots of different work, and sometimes it's hard to have us all sitting in one room just because of how few we are on the continent, in the country of Kenya, on the continent of Africa. So digital pathology is going to really change how we work and how effective, efficient, how good we are. Yeah, so anyway, Vignette number 2, this is going to be the work of the pathologist. This glass slide will enable the pathologist to make a diagnosis, make a report, send the report to the surgeon, who will then continue with patient management. Yeah, that's case number 2. So the third vignette we're talking about is a newly diagnosed HIV patient. This patient has cervical lymphadenopathy. That means they have swollen lymph nodes in the neck region. Cervical refers to a neck. That's why the uterine cervix, because it's the neck of the cervix, it's called a cervix. But cervical lymph nodes are lymph nodes in the neck area, so below the chin, along the jaw, in the neck area. And swollen lymph nodes, the patient also has fever, and they also have weight loss and night sweats. All right, no cough, and no cough is a clue. All right, so let's break down this vignette. No cough is a clue. Fever, weight loss, and night sweats are a big clue, but the biggest clue is the cervical lymph nodes. There are various things that can make the lymph nodes swell up, but the patient having newly diagnosed HIV should help you bring up a few things on the list. So one of the major things would be TB, and that's what this vignette is trying to illustrate. It's illustrating tuberculosis of the lymph nodes. That's a kind of extra pulmonary, that is TB, outside the lungs. It's now in the lymph nodes. And this lymphadenopathy can also be caused by various other things like lymphoma and other kinds of infections. But the fact that they said no cough is meant to make you think of TB, but TB outside the lungs, right? Cough is often the TB that's in the lungs. TB outside the lungs, like in the lymph nodes, you'll just have fever, those symptoms like fever, weight loss, night sweats, which are called constitutional, meaning they're not specific to anything, but they're often there when you have an illness like TB, okay? So those are the points to jump out at you. You should be able to make the diagnosis of TB pretty quickly. And then what happens is this patient will be sent for, most likely, the best test is a pathologic test called a fine needle aspiration, or FNA. FNA is a test that uses a fine needle, a small needle, very small needle. It's applied to a swelling, and we obtain cells, a biopsy of cells from that swelling, and that helps you make a diagnosis, right? So with that kind of FNA procedure, the pathologist can then make a report, and then this report can then be sent to the doctor to help them administer the TB medication, right? Evidence-based, meaning they have to have real diagnostic evidence. So this FNA procedure is done by a pathologist, like me, an anatomic pathologist, and they'll then give a report to the doctor. And then we have practiced best medicine. We have evidence for the thing that we are treating, okay? And again, the pathologist is speaking to the doctor, right? The doctor asks, I think this is TB. Can you check? Then we do the test, check, do our special stains, make the diagnosis, make a report for the doctor. The patient will likely not know about this communique going on in the behind the scenes, but it's happening. And that's again how, in this case, pathology has been used, is paramount for this diagnosis and for management. Okay, so our final vignette is a 54-year-old man who died after experiencing vague chest pain. Now, this vignette has a trick, right? Again, the things to note are the patient's age. He's 54 years old, meaning he's an adult, and gender as well could be something that's pointing you towards a particular the diagnosis in this case. But again, age and gender aren't so big here. So 54-year-old man, vague chest pain. And the vague is a trick because this vignette is meant to indicate a heart attack, a myocardial infarction. But a heart attack often has this, the pain is described as very classical pain, left-sided chest pain, squeezing or tightness in the chest, and then radiating down the arm. But one thing to note is quite often in practice, the pain can be vague or non-specific, right? And the patient has passed away, meaning it was a very serious thing that made the patient pass away. In a true exam setting, the vignette might have a bit more detail, but for the purposes of this lecture, that vignette was just to indicate a heart attack, a myocardial infarction. And where pathology comes in this case is they didn't make the diagnosis before the patient died, right? So this patient has had sudden chest pain and then passed away. So a post-mortem is very important, number one, to give a diagnosis. What's the cause of death? Because before that, it's undetermined, which is not very good medical practice. It's also not very good legal practice. When someone dies suddenly, that death has to be investigated, right? Even if it's pretty obvious what it could have happened, okay? Another reason, a good reason to do an autopsy is there may be something else that could have been contributing to the illness and to the passing away, to the death of the patient, that has not yet been determined by the pre-diagnostic means of investigation. That is, the patient may have had a biopsy that was negative. They may also have had imaging, CT scan or MRI that was also negative as concerns this particular thing, right? Then when you do the autopsy, you find aside from this main thing, there's another thing that is big enough to contribute to the cause of death. So medically, you must find everything. You must be very comprehensive in medicine. You must find anything that's causing illness or death, all right? Another useful thing for autopsy is in forensic investigations, in criminal cases, right? Often autopsies are used to determine the cause of death and determine the manner of death. Was it by homicide? Was it by suicide? Or was it accidental? There are many different manners of death. So in forensic investigations, autopsies are done a lot. And I think that's why one of Kenya's most recognizable pathologists is our chief government pathologist who does forensic autopsies quite often. He's on the news quite a lot lately because we've been having many cases of femicide. He's at the forefront. And it's very, very important work as concerns diagnosis. It's a post-mortem diagnosis, meaning diagnosis after death, post-mortem, but very, very important. Also, another thing is it's good for closure of the family, right? When one of your family members, God forbid, they pass away without knowing what the cause is, it's often, I've seen it happen firsthand many times. It's not a good thing. And one of the tools of medicine is to do this, like to give answers, right? So these answers really, really help. They go a long way to give the family closure, to be able to tie everything up. And then sometimes the cause of death might be something that could affect other family members. So like an illness that's genetic, and you discover it on autopsy, you can then be able to have others get tested and either prevent the illness or catch it early enough to give good treatment, right? To save a life. So autopsies are really, really, really important. Yeah? Okay. Yeah, and that's how pathology comes in that last case, that last vignette. We use pathology for a post-mortem diagnosis. Yeah? And that's the end of the vignette. Yeah, the end of the episode, actually. Thank you so much for being here. Thank you for listening. I'll see you on the next one. Take care of yourself. Eat well, sleep well, be kind, right? Heal so you can be kind. All right, take care of yourself. See you in the next one. Bye.